Welcome to NYC Health and Hospital Kings County YouTube podcast. Today's episode, we will focus on safe sex. My name is Maria Abdallah. I'm the HIV Medical Director at Kings County Hospital. Today, I have with me Ms. Kelly Morris. Ms. Morris is a family nurse practitioner with over 18 years of experience in HIV care and prevention. She's also one of our major contributors to sexual health services at Center for Hope. We are going today to talk about some sexual health facts and get advice from Ms. Morris on how to prevent sexually transmitted infection. Ms. Morris believes in the H&H mission and wants to provide the best care to our community. Hi, Ms. Morris.
Hi, thank you for having me today.
So, Ms. Morris, I'm going to start with some facts, and then I will go to more questions after. So, as the CDC report increasing in sexually transmitted infection in the nation, New York is one of the highest ranking states when it comes to STI cases. Infection rate for Black New Yorkers is almost 3 times that of white New Yorkers. Young women's bodies are biologically more prone to sexually transmitted infection. Ms. Morris, I know you see patients all the time in your clinic. You see young women of reproductive age. I want to start with one main question that I'm sure your patient asks you. How do we contract sexually transmitted infections?
So, a sexually transmitted infection can be contracted by skin, genitals, mouth, rectum, or bodily fluid with a person who has a sexually transmitted infection. So that's orally, anally, or vaginal sex.
Thank you, Ms. Morris. And on your daily work, when you're seeing patients and they come to you surprised that they were tested positive for one of the sexually transmitted infection, what do you tell them if they don't have any symptoms and meaning they don't feel any problems and they still get an infection? How do you explain that to them?
So yes, I get that question all the time. Many people are tested and they find out that they have a sexually transmitted infection. And they're like, but I don't feel anything. And I let them know, like, listen, you can still have a sexually transmitted infection and not have symptoms. There are many STDs out there that are asymptomatic, meaning that you will not get any symptoms. For example, chlamydia, gonorrhea, even syphilis. You may or may not get symptoms, but you can still be infected and you can still pass that on to your partner.
Yeah, that's very important. Thank you so much. I want to reemphasize that even if the patient don't have symptoms and they have a sexually transmitted infection, do they still transmit it to their partners?
Yes, they actually can. So they may not feel any symptoms. However, they still can pass on that infection, yes, to their partner.
Now, another question that comes up a lot. What do you tell them in terms of regular sexually transmitted infection screening, meaning testing? How often do they test if they have an infection now? After how long? And how often they should get tested?
So I believe that question is individually based because, it depends on that person. You could be in a monogamous relationship and you may just want to do testing maybe every year just to make sure, I don't have any sexually transmitted infections. However, there's some people that feel like I may be in a relationship where my partner is having sex maybe with other people or I'm not sure. Then, you may want to get tested every 3 months or every 6 months just to be, okay.
Yes, thank you so much, Ms. Morris. This is really case-by-case recommendations. So now I'm going to go more into one specific sexually transmitted infection, which is syphilis. That's really raising a very important now concern at the public health level. Patients are getting more syphilis like any other STI, but also pregnant patients are getting syphilis, and we're getting more congenital cases of syphilis. If we want to talk more about how syphilis affects pregnant and the newborn, what can you tell us more about this?
So yes, right now, New York State recommends that all pregnant women are tested for syphilis in the beginning of their pregnancy and towards the end of their pregnancy, which is their first and third trimester. Also, 40% of women untreated with syphilis can give birth to a stillborn baby, which is a child who dies at birth. Which is very detrimental. Congenital syphilis is also something that, affects the infants that are born with syphilis. It could cause them to have bone damage, severe anemia, jaundice, rash, blindness, and deafness, which is also very horrible for the child.
What about other sexually transmitted infection and pregnancy? How does gonorrhea and chlamydia impact pregnancy?
So gonorrhea and chlamydia impacts pregnancy, can have a woman to go into preterm labor. It also causes for the infant eye infections and very bad severe infections.
So now, Ms. Morris, I'm going to talk about another also important question that comes up a lot is how can we prevent pregnancy? What are contraceptive devices we have? What are our options? What would you tell your patients?
So now in 2024, we have several options out there. We have pills, which we call oral contraceptive pills. We have implants that are placed under the person's skin. We have injectables that can be given to a woman every 3 months. We have patches that can be switched every week. We have the vaginal ring that is removed every 3 weeks. We have an intrauterine device which can stay up from 5 to 10 years. And we also have condoms.
Do you recommend one over the other? Which one would you recommend for your patients?
I don't have any recommendation one over the other because it all depends on the person's lifestyle and works best for them, what is good for them. So everyone, has their own lifestyle and it's a case-by-case basis. What is good for you?
Yes, thank you. And especially if they have other medical problems, certain options are better than the other. Okay, now I'm going to go to another question that comes up a lot in our practice. Patients are diagnosed with sexually transmitted infections and they're really stressed out. It causes a lot of anxiety. And at that point, they decide they're not doing any sexual relation anymore. They don't want to do anything anymore. And what we call abstinence. What do you tell them when this comes up? When abstinence is really recommended? And what are the benefits of practicing abstinence?
I don't want anyone to be abstinent when they don't want to be. The reality is that people are going to have sex. When we will say to be abstinent, it would be definitely if you're taking medication for a treatment. You want to refrain from sex, and you also want to refrain from sex for 7 days after treatment has completed. And I also tell my patients, make sure that you have all your labs back before you start having sex again as well, too.
Yes, Ms. Morris, that's great. And we want to make sure to tell them to get their partner to get treatment. So now, what are the tools if they want to prevent sexually transmitted infections? Again, like we said, abstinence is not always the right answer. Sometimes it's useful when we're treating the patient. But what do we have to make them prevent infections like HIV or any other bacterial infections?
So now we have some tools to help with prevention. We have PrEP, which is a tablet or an injection that you can take to prevent you from getting HIV. It doesn't prevent you from getting other sexually transmitted infections like gonorrhea, chlamydia, or syphilis, but it does prevent you from getting HIV. We also have something that's fairly new. It's called H.O.P.E, and that's a medication, 2 tablets. You take it within 72 hours of unprotected sex, and that will help to prevent syphilis, gonorrhea, chlamydia, which I feel is a game changer.
So yeah, thank you, Ms. Morris. So, at the end of this episode, I just want to, summarize what are the take-home messages that you would tell our audience? Like, after listening to this, what are the points that you want them to go home with?
Definitely would want, my audience to know that we have medication out here to help prevent them from getting HIV and other STDs like, gonorrhea, chlamydia, syphilis, which is PrEP, and H.O.P.E. I also want people to know that don't worry if you feel like I can't afford to come to clinic or, we take people no matter if they could pay for this or not. There's services out here for everyone. So please come down to your nearest sexual health practice because this is where we give advice. This is where we teach, we educate, we test, we treat, and we take everyone.
Thank you, Ms. Morris. This was very helpful. And yes, we want our patient to come, to have the education, to have the tools to make the right decision for their health. And I want to thank everybody who's listening today and tune in for more episodes.